For our plenary session this morning, we are pleased to invite Dr. Tina George of the WURI Project, World Bank. She is a senior social protection specialist and the regional task team leader of the World Bank's first 10-year multi-country operation on regional interoperable foundational ID systems for West Africa. We're really proud and grateful that she had time to be here today. Can I invite you on stage, ma'am? Dr. Tina George.
Good morning, ladies and gentlemen. It's a real pleasure to be here today. I want to start with a story. This is WURI Novisi. She is a farmer and a widow. She's a grandmother who lives in southern Togo with 13 grandchildren. Like many other informal farm workers, she has no access to social protection. When the pandemic hit in 2020, she found that her vegetables that she grew were rotting and that she could not make any money. But she had a mobile phone. She was able to create a mobile money account, register for a program called Novisi in Togo, and receive mobile money immediately as an emergency cash transfer. The amazing thing about what Togo did during the pandemic is truly something novel that we have learned from for a global context. Now, why am I speaking about Togo? Let's place this in larger context. Ending extreme poverty by 2030 requires bold action on the part of the global community. About 8.4% of the world's population, that's about 670 million people, live in extreme poverty. That is extreme poverty. And despite the expansion of social protection programs during COVID-19, 4 billion people around the world remain unprotected by any form of safety net. And today's global challenges have really far-reaching consequences. During the pandemic, we saw children being out of school, increases in morbidity, in mortality, setbacks to learning, and these have implications for human development and human capital outcomes for people becoming productive members of society and contributing to society and to economic growth of the country. These have long-term impacts. Now, harnessing technology, data, and innovations, as we have seen here in these past few days, are really a unique opportunity for us to be able to utilize those and scale up the response to crises and shocks around the world, such as climate, conflict, health-related shocks, among others. Now, what's quite interesting about the subject of social protection is that it's not a single-dimensional subject. It is cross-cutting. So if you think about the life cycle of a human being, you would say, you have a pregnant mom who might need maternity benefits, babies, child and birth allowances, early childhood. So the first 1,000 days are most important for children for their long-term gains. So nutrition supplements in terms of early childhood programs, childhood through schooling, and then going into school meals programs, which many countries offer, scholarships to youth. Youth could be at risk of getting into the wrong groups, and so there may be issues of crime, violence, substance abuse. There may be psychosocial support, counseling, to working age adults who need to be active and working, or maybe unemployed or discouraged, or maybe women who may not be in the workforce, to elderly people, to disabled. As you can see, throughout the life cycle, there are so many different interventions that typically people receive from the government or government's design. And this is fundamentally a fragmented subject, and therefore social protection requires a whole of government strategy to be able to coordinate all of these different fragmented programs and to deliver to people in a way that is meaningful to them. So something that we have noticed, in our analysis of all of the different countries that we work with, and we work with about 190 countries and the social programs in these countries, is that despite the differences in all of these different programs, let's say a cash transfer program such as the one that Novisi offered, which is low touch, it's completely contactless, so you could receive it through a mobile money account, and you never have to interact with going into a government office, for instance, to a high-touch program where you might be receiving counseling or psychosocial support, where the social worker might be accompanying you or might be accompanying the family. So even if you take these two very different contexts, we see that the delivery framework is more or less the same. Almost all programs require some form of outreach, intake and registration, an assessment of their needs and conditions, a decision on benefits, what kind of package of benefits is to be provided, a notification to those individuals or households as to whether they have been deemed potentially eligible or not, and then the provision of those benefits, whether it's in cash or in kind. It could be food assistance, for instance, such as India's PDS program, the public distribution system, which reaches 800 million people in India, by the way. And then the management of all of the information around beneficiaries, so that's in the purple, and so you can see that we've color-coded this. So in spite of all of the differences across programs, any program needs to go through what we call this delivery chain framework. And the delivery chain is underpinned by technology and data, and they intermediate between people on the one hand and the state or institutions, and these fragmented institutions on the other hand. But we need to keep in mind that delivery systems, so the plumbing that allows us to deliver these fragmented social programs, they are a means to an end. And it doesn't exist in a vacuum. So we have to think about the national social protection policy architecture. So there might be a national social protection policy that might place an emphasis on human capital development, or there might be a consumption floor in terms of the poverty. So there are many different policy architectures that then determine what kind of programs are delivered in the country, and then the delivery systems underpin those programs. And I want to make sure that that is very clear, that it does not operate in a vacuum. Which now brings me to my big eye chart, which is what we call the Digital Social Protection Delivery Systems Framework. And what this is, as you can see down below, you see the delivery chain, which is that big blue section, which is assessing people's needs and conditions, the enroll, which is enrolling people in programs, provide, which is providing payment of cash or different in-kind benefits, and managing people. So you see the delivery chain underpinning it, and you see all of these different systems. Here are the technology elements or the components that all work together. And so this is not a single monolithic system, as the tech folks might say. This is actually a microservices-based system, right? So these are components that have to work together seamlessly and transfer power for it to work. So you have dynamic social registries that assess needs and conditions, unique identifiers, which we've heard a lot about, unique identification, civil registration systems, beneficiary operations management systems, so these might be health programs, social insurance programs, the cash transfer programs, all of these different programs, integrated beneficiary registries that basically look at data across all of these different programs, who gets what, and what are there gaps, overlaps, duplication, and portfolio planning, and ministries of finance in countries typically use these. And multi-program, multi-provider payment systems. That is not that each program has its own payment system, but programs have a multi-program, multi-provider. That is, you give choice and convenience to people. It doesn't matter whether the government has only one way of delivering payments to people. Governments need to be able to deliver payments to people based on the modality that they want to receive in and the modality that is most easily accessible to them. grievance redress mechanisms, case monitoring systems that allow social workers to go out to the field and to accompany them, geographic information systems, data analytics. As you can see, there's a whole host of different systems that are involved in delivering these social protection programs. It's not very clear in the bottom, but in the bottom, what you're seeing is the interaction with many other government systems or administrative systems. So I'm not going to go into any of the components because we do not have time today, but I will leave you with maybe this one piece on dynamic social registries, because we always receive questions as to what are social registries and how do they work. So let me just give you a little bit of information on this. Social registries automate the process of outreach, intake and registration, and the assessment of needs and conditions. And what social registries do is they could intake data through self-service, or they could intake data indirectly from a variety of sources. It could happen through many different modalities, through digital service windows, through community service centers, mobile teams and facilitation agents, home visits, census survey sweeps, administrative data sources, and non-traditional data sources. So social registries intake data from a variety of different sources, and they're able to then compute to be able to assess, are you in need, are you poor, are you vulnerable, depending on the policy architecture and the policy questions that are being asked. So, these are not straightforward systems. They're also not monolithic systems. Social registries architecturally are not centralized. They could have a variety of different architectural elements to be able to put them together. You could even think of virtualizing data, bringing data up on the fly, and then throwing it away, so you don't store that data. So there are many different modalities to provide it, so I don't want you to go away thinking that these are centralized monolithic systems. They have to use best in practice architecture to build social registries. And there's a front office where people come and interact with the state. There's a back office where you have program administrators who are doing computations or looking at the data, looking at conflicts in data, and then there are all those database elements as well. So let's go back to Novisi. Let's see what Novisi did. How did our grandmom, who in Novisi, receive her benefits? So this is that assessment of the needs and conditions. Togo used two approaches. There was a low-tech approach and a high-tech approach. In the low-tech approach, Togo used uniqueness. Are you truly unique? Are you truly who you say you are? Your employment information, because these were informal workers who were most impacted by the lockdown. And then their location, because there were two specific areas under lockdown where benefits needed to be provided to. So they used categorical data to assess needs and were quickly, in 2 minutes, within applying in 2 minutes using a USSD code, you would know whether you were going to receive money or not, and they received the money. And so that was the low-tech approach. In the high-tech approach, where they had to go out to rural areas, Togo had a partnership with the University of California, Berkeley, with Innovations for Poverty Action, with the World Bank, with NASA Harvest for geospatial data, with the NGO Give Directly, with Agence Française de Développement, with the AFD. So Togo had partnerships with many different groups to be able to put together a high-tech model. Now, in the high-tech model, as you can see over here, Togo used geospatial data to be able to determine, to put together a poverty map. And so these are machine learning techniques that look at the patterns in the data, using consumption data from a survey that was done and the satellite imagery to rank the cantons. Cantons are administrative units. The 397 cantons were ranked from the poorest to the richest cantons. So that was the first step that they did. In the second step, they then needed to see, now if I know these are the 100 poorest cantons, how do I know who are the poorest individuals in those cantons? They used call detail records. Anonymized call detail records were used, again, using machine learning techniques and using the training data set for the artificial intelligence was actually looking at these phone surveys on living standards, and then they were able to look at the consumption, the daily consumption of 5.8 million mobile subscribers, and what their estimated consumption was, and whether it was below $1.25 a day. So this was what Togo did. They were able to do this geospatial poverty map, look at who might be the poorest individuals in those 100 poorest cantons, and determine benefits. So that was on the social registries bit and the technology. But this shows us that we need to have some sort of a modular architecture for data as well. So it's not just about the technology. The data is fundamental, as you can see from the Togo model. And as you can see over here, we have illustrated this in sort of a modular fashion. So the first section are the unique identifiers. We've talked about it over here. This is, who you are. These are the attributes, the biographic attributes that are underpinned by the biometrics, right? And then you have the household, that is the household composition and the household numbers, and who are in the household. So the father, the mother, the children, or it might be a single adult, female-headed household with other members of the family. And then you have another module, which is what we call welfare proxies. And this is really the socioeconomic data that we need to assess people's needs and conditions, that is, whether they are poor and vulnerable or not. And then you can have different modules, such as the education module, the health module, and different programmatic modules as well. So thinking about data in addition to technology and thinking about data in a very modular fashion is also really fundamental to delivering these social programs. Just to give you an illustration of dynamic social registries and the kinds of data that they rely on. So as you can see over here, it's again not very clear, so maybe let me try and, so there's self-reported information. So this might be information that you go out and report, and that's on who's in your family and what's the composition of your household, what's your education level, health and employment status. So these are things that you might self-report to the government. And then you have administrative data sources because you're interacting with the tax system, you're interacting with the social security system, with unemployment, pensions, universal health insurance, the educational systems. You're interacting with a whole range of different government programs, and those programs are collecting information, and social registries might rely on those data sources as well. And then as we saw from the Togo example, you have the non-traditional data sets such as anonymized call detail records, satellite imagery, night lights, weather, and so forth. And then you have all of these different administrative data sets that are brought together as well. So as you can see, there are lots of different data sources that you're drawing from to be able to build. So now let me switch tracks to the third part and say, we can do all of these beautiful things. We can build beautiful tech and data, but without dignity, there is no inclusion. And I can tell you that dignity is fundamental to all human beings, and it's essential for the human rights agenda. And you can see that when, even if you say, I need to gather information from all of these data sources, the application forms that you design and you put out on the front end might be so complicated that poor people may not understand, what am I supposed to fill in? The food stamps program in the US, for instance, has 50 screens to fill in before you can be considered for food assistance. In California, they were able to create, there was a civic tech group that were able to go out and make that a really compact application on a mobile phone to apply for food assistance. There may be unclear processes. You have no idea if you apply, what happens next, what else do you need to do. There are lots of different things that are not clear to people. And there may be many different programs. What should I apply for? Should I apply for food assistance? Am I going to get scholarship for my children? Or is there some conditionality that I cannot fulfill? These are all things that are unclear. And let's say you are digitally literate and you do end up going on the web, you have systems interruptions. They say, sorry, the system is down. come back later, so people are not able to apply. Or if you go to an office, you wait all day to be able to apply. So these are kind of indignities that people are subjected to. And as you as you probably would know, for someone whose income is precarious, they cannot wait all day in an office. One day of income lost means food on the table and the family. It's a struggle, it's a day-to-day struggle. So we do not want people to be sitting in offices wasting the time that they could be doing productive work. And then there's the stigma as well. This photograph of garbage in a social program office is actually a real photograph, and I won't name which country, but it is from a developed country where there's garbage because it's okay, right? It's not okay. It's not okay to have that sort of stigma because you're not stigmatizing people who apply to social programs, and then there could be language barriers as well. And so dignity is often lost in that interface between people and government. And when we design these tech and data programs and to deliver social protection, we need to remember that people are not the last mile. They are the first mile in delivering social protection programs and human development more broadly. When you drag fiber optic cables to the last mile or to the household, or transmission and distribution lines to the household, yes, the household is the last mile for infrastructure, but the household is the first mile for human development programs. For us, the bottom 40% are our first mile, and that is something we say that's the weakest link in the delivery chain. What you see over here is a composite example that shows that you may have a lot of different administrative systems in the back end that are supporting unemployment insurance for this lady, Anais, for instance, who lost a job, and then it took her 63 days to be able to get her unemployment benefit. And she went through so many different emotions. So people have emotions when they are dealing with the state. They are distraught, they're uncomfortable, they're unhappy, and then when they receive a notification, they may be relieved. And when they finally get the check in the mail, so the check in the mail, they may be delighted. But the KPIs of the ministry or the agency are perfect because it only took 63 days. It was very efficient. There were these beautiful systems. We used data, but the person on the other end was not really well served. And so human-centered design and thinking of people as the first mile is really fundamental in thinking about these programs. And so now let me bring it back to Novici now. What was the salience of Togo's Novici approach was that it put people at the heart of design and delivery. What you see on the top is what Hue Novici had to deal with. The only thing she did was there were outreach messages coming in through radio and community leaders. She went to her mobile phone and she pressed star 855#. She provided a few data points through USSD. And then there was a lot of stuff happening in the back end which was abstracted from her. She didn't need to know about it. So it was completely abstracted from her, and she got a notification and she got paid. So it was end-to-end digital, and all of the administrative efficiencies in the delivery systems framework served her in the back end. And to us, what Togo did was it put people at the heart of design and delivery. And so in closing, I would like to leave you with 3 points. Inclusion, that is dynamic inclusion of people, providing dignity to people in designing programs and delivery systems, having a human-centered design approach. When you have these elements, you engender trust between people and the state, and the coordinated delivery of these fragmented social programs works to serve the people in your country. Thank you. I'm going to leave you with a few resources. I think if you would like to read more, we have many publications. So if you just put up the slide set, I'll just show you a few publications you might be able to Let me click through. Okay. So we have the social registries paper from 2017. You can look at it on the World Bank website. How do I go back? Oh yeah, there we go. And then you have the source book on the foundations of social protection delivery systems. This was a labor of love for many of us. Okay, that's 2020. Targeting, which is a complex subject, in case you're interested in the subject of targeting. And then we have a new publication coming out, which is the playbook on dynamic inclusion and interoperability, where we detail the digital delivery systems framework. Thanks.
Very inspiring work done in Novici. How can we replicate this in other places?
How can we replicate Novici in other places? So I would say that Novici was the first step. So Novici showed what was possible, and Togo is actually building large-scale systems, as I showed in the digital delivery systems framework. They built unique identification systems, and so this year, hopefully, all 8 million people in Togo will have access to digital IDs. They're building a dynamic social registry. The team is putting together what kind of data sets, data sources, what kind of interactions people need to have with the state. They're putting together program management systems to be able to manage social programs. They're looking at interoperability frameworks, data security, privacy. So it's really thinking about it as a big picture element and then addressing components at a time. You don't need to do all of it at the same time, but you can start small, do a few things, do it really well, but have the big picture in mind, and then keep going and iterate, and always have the problem in mind. Never start from, I need to build a system, right? It's what problem are you trying to solve? That's what I might say we see in multiple countries, also drawing from the Togo experience.
Hi, Tina. I know this is an insider's question. Building on what Ramesh was asking, it's a comment and a question. If World Bank can facilitate not just the learnings to get out there, but the code and documentation as digital public goods, will probably spare many of us the effort of reinventing the wheel. I do hope that you would consider this as a serious request. If not, do you have any thoughts on it? Thank you.
Absolutely. So I'm not qualified to speak about that because that's not my area. But I do know that we have colleagues at the World Bank within the Social Protection and Jobs Global Practice who are working with 23 other social protection agencies through what we call the Social Protection Interagency Coordination Board. So we have a board that brings together the World Bank, WFP, ILO, GIZ, a whole host, UNICEF, a whole host of agencies, and we put our minds together and think about what interoperability framework, DPGs, and other aspects need to look like. And I think Anita's in the audience, and she'll be talking about the Digital Convergence Initiative later today, so that might be the right entry point for it. Thanks, Aaron.
Hi, this is Jeremy from OpenSPP. What do you think about the use of AI for targeting, and how can it be used? Yeah.
What do I think of, thanks, Jeremy. So what do I think about it in terms of what element are you looking for?
Yeah, like the risk and the benefit of it when we're doing targeting and for inclusion.
Okay, very good. Thank you. Thank you for clarifying. Yes, absolutely. So in using machine learning, and I'll refer to a couple of really good publications and papers that are out there. One is I would highly encourage you to read Catherine Tucker from MIT Sloan. She has a lovely paper out, I think published 2023 or 24, on algorithmic bias and exclusion. It is absolutely correct that sparse or missing data will cause algorithmic bias, and which is why inclusion is really important for machine learning. So if you do not have a mobile phone, if you have no way of inputting data, or if you are marginalized to the extent that you may not even apply for assistance, then your data is not in that data set, and you are going to be fundamentally excluded. So yes, algorithmic bias is absolutely a big issue. And then you have fairness, accuracy of algorithms. There are many, many different risks. And I would say that it's our policy choices, how we address those. And we need to make those policy choices in a very considered way, not to be afraid of it, afraid of risks, but to fundamentally mitigate those risks in every single context that we're working in. Thanks. Any other? I think we're out of time, but thank you. I really enjoyed speaking with you, and have a wonderful rest of your day.